We've identified a new asbestos-related disease, and we're figuring out ways to avoid it.
Her story lives on in each and every one of you.
Firefighters that have lost their lives, that have really put everything on the line.
Well, thank you all. It's very nice to be here, and I want to just say on behalf of the Service Employees International Union, where I work, that we want to congratulate ADAO and all of you for the work that you've been doing for many years, and thank you on behalf of our members, many of whom are exposed to asbestos, that you're working on efforts to try to improve their lives and improve their workplaces. So thanks. So my topic to talk about today is some of the issues around worker training around asbestos, especially that's being done by a number of labor unions around the country, and so that'll be my topic. And maybe at the end, we could think about some ways where we might be able to better integrate that training and that expertise with ADAO and related groups to kind of work together more closely. And so just currently, there are hundreds of incredibly qualified, effective asbestos trainers working for various unions around the country doing training for their members. The Insulators Union has a whole cadre of these trainers with sometimes decades of experience. Our union, SEIU, has trainers who are doing training with maintenance workers and other workers who get exposed to asbestos. Many of the building trade unions have very elaborate programs of both classroom and hands-on training that has produced, I think, a core of really well-trained workers to deal with the asbestos in place that will be in place for quite some time that some of the earlier speakers have talked about. So I would just think we should recognize that there's really this vast resource that we have available. So starting back in the 1970s, after the creation of OSHA that dealt with worker health and safety issues and the Environmental Protection Agency that dealt with environmental issues, and both of those agencies, asbestos was an early topic of concern for both workplaces and the environment. So organized labor started actually dealing with training our members and training workers in various ways around the hazards of asbestos and dealing with it. And this was, in part it was because of the increased recognition of the hazards of asbestos to our members who worked in breakthrough manufacturing plants and other plants where they were being exposed to asbestos. But there were also some increasingly strict OSHA regulations in the 70s that were beginning so our company policies were changing, and that required some changing of our members' knowledge about how to deal with asbestos. There was a growing concern about asbestos in schools because of potential exposure to children, but also teachers and maintenance workers and others in schools. And then we started to see in the late 70s the construction industry, as some manufacturers and some owners of buildings wanted to have early types of asbestos abatement work done rather than just ripping and tearing out the asbestos with no concern for the dust, but to do it in a way that was more controlled. That was the forerunner of this sort of asbestos abatement industry in this country. So because of those reasons, unions got involved for various reasons in training. And I'm going to run into this. Okay. So as we go into the 1980s, I started doing industrial hygiene, health, and safety work in 1981. And the 1980s were actually this incredibly powerful time when we accomplished a lot in this country in terms of asbestos issues and controls, especially in workplaces. So in the early 1980s, the Environmental Protection Agency, kind of looking forward, started looking at better controls of asbestos, again, focused on schools, but becoming broader than that in terms of other buildings. And the EPA, in terms of training, started providing funding and support to states to set up training programs that would be overseen by the states, where they would oversee private training firms who would train workers who were going to be doing asbestos abatement work. So workers, supervisors, and others who would be removing the asbestos. Even though there wasn't a lot of strong regulations on how to do that, there was this sense that we needed to train workers as one way to deal with the public health issues. In 1986, SEIU, our union, and many other unions actually fought for and won the 1986 AHERA regulations, the Asbestos Hazard Emergency Response Act of 1986, that applied very strict requirements for asbestos control, for inspections, for removal and dealing with asbestos in schools. So uniquely aimed at schools, but became a model of a pretty good way to control asbestos and to try to prove that it could be done. And part of that required that this training that the EPA has seeded with the states to start doing these certification programs, that became a national program. So if you were involved in various tasks dealing with asbestos, from inspecting buildings to designing removal and other control projects, to being workers or supervisors running these projects, you had to be certified by an approved, generally private sector training program, but overseen by the states, with inspections and follow-up to make sure that the training was actually effective and that people coming out could actually do the control measures needed. Now, this wasn't a panacea, because training is only one aspect. If a contractor wants to be a lousy contractor, trained workers aren't going to stop that. But if you have trained workers, it's a way to help the contractors do better. Okay. And so the quality of, what we saw was the quality of training seemed to really improve quite a bit with this whole certification process. And you had fewer fly-by-night workers and contractors doing the work. You had people that actually understood the hazards of asbestos. And many unions and groups, COSH groups and other nonprofit organizations became training providers and were part of this whole process. And so, and then that paralleled in 1986 with OSHA adopting a better worker health and safety standards, which also included some training aspects. So by the middle to late 80s, we had this sort of growing cadre of fairly well-trained and growing experienced workers and contractors who could deal better with asbestos than we'd had 10 years before. One of the things I noticed, because I did a lot of work with a lot of different unions in the building trades at the time and did a lot of asbestos training, worked with lots of these trades trainers who become very good trainers. One of the things that we noticed was that much of this workforce were people who came out of the construction trades, whether union or non-union, but they were from asbestos families or from construction families who knew this work. And you didn't really have to spend a lot of time about the hazards of asbestos. And one of the earlier speakers said, you just have to know asbestos is bad. And that became the shorthand for the health hazard section of this training, was asbestos can kill you. You've all had fathers, uncles, brothers who died from this. You all know that. And that always struck me as being really powerful, that we had people learning to do this kind of work who really understood the ramifications of really doing a bad job and exposing people to asbestos. I remember we were doing training for workers actually in Nome, Alaska, who were removing the asbestos from an old high school in the far north of Alaska. And many of the workers had younger brothers and sisters who were still going to the school. There was only one high school in Nome. And so they were going to remove the asbestos from the school where their brothers and sisters were going to when the project was done. They were the most careful workforce I ever ran into. Okay. So into the early 1990s, at the same time the EPA had been working on the U.S. ban of asbestos, which we thought was going to take place, and before it got overturned, there was the Congress actually expanded the training requirements of a HERA that was aimed just at schools. It expanded the training requirements of that for workers who were involved in all schools and public and commercial buildings in the U.S. And so we were hoping to expand all the HERA requirements that would require better asbestos control, but Congress only saw fit to really adopt only the training requirements. So at least we had a trained workforce around the country dealing with most of the buildings that we were going to that we would see asbestos control in or asbestos abatement in. And but one of the things that we also started to see in the early 1990s was the workforce started to change. We actually saw lots more non-union workers doing this sort of abatement project. Abatement projects went from being $10, $20, $30 million projects to smaller projects, and non-union firms are more likely to bid on to get those bids. And increasingly what we saw was that the abatement workers coming through training programs are workers who had no real connection to asbestos. It wasn't a family history of working in construction. They didn't know anybody who had been exposed to asbestos, hadn't known anyone who had died of mesothelioma. And so to them, it was this theoretical hazard. It was a way to get work. And a lot of the procedures seemed to be a lot less important to those folks because they didn't really have this sort of gut knowledge about the dangers of asbestos. So you'd switch again. Thank you. So I just by the early 1990s, this is the scheme we have, and this still exists today here in the U.S. in terms of certified training for asbestos. So if you're going to be an asbestos worker doing abatement work, supervisor, you're going to inspect buildings, or you're going to be a project designer for any school, public, building or commercial building, and you have to take and be certified through a state-approved training program that requires you have this total amount of class time from 3 to 4 to 5 days, depending on your status, and that the training actually has to involve a hands-on component where you actually practice wearing the protective gear, you practice containing asbestos, you practice going through decontamination, and you practice problem solving. What if the negative air machine goes down and asbestos could now get out of the area and get into the building? How do we quickly resolve that issue? And so there's a lot of problem solving that goes on. So this training, I think, and from my experience, is actually, if it's done well and the workforce goes out to work for decent contractors, we end up with a really highly skilled workforce that can really deal with controlling asbestos so that they're protected, their coworkers are protected, families are protected because they know not to take their work clothes home and not to contaminate their vehicles and things, but also the public is protected. And so there's just wins all the way around when this works really well. Okay. Now, if we go to the next slide, there are some categories of workers, and this is where the union I work for these are people we represent mostly that do this kind of work. They're not part of the certification system. There are requirements under OSHA regulations and some EPA regulations for training, but there's no oversight. It's whatever the employer decides is okay, and doesn't have to be hands-on training for the most part. So this 2-hour asbestos awareness training is for maintenance workers and custodial workers who work in facilities where there might be asbestos, and they're not supposed to disturb it, but they're supposed to be aware of what not to do. And if they find asbestos disturbed, they're supposed to know who to call to get it cleaned up properly so they're not exposed and the public's not exposed. And then in addition, there's this 14-hour additional training called operations and maintenance, and that's for all the tens of thousands of maintenance workers in buildings who would drill into a wall for a reason, do a small repair where they could episodically remove or disturb small amounts of asbestos, be exposed themselves, leave residual asbestos around for others to be exposed, and they're supposed to know how to do that. These two categories we don't see as all that effective, and increasingly what we seem to be seeing is employers are not training workers in these categories who work in buildings that have asbestos in it. They're just simply not being trained. Okay, so we're seeing that we represent workers in lots of hospitals, and we're seeing modern hospitals, high-powered hospitals these days that are in old buildings, are telling their maintenance workers and janitors that there's no asbestos in our buildings. Not sure how it all got out, but it's not there anymore. And they're actually being told it's been banned in the U.S. and there's no asbestos. Don't worry about it. So I think that those become big problems, and we need to sort of figure out how to regroup with the training and go back to better training that's going to help so that the workforce is better able to recognize how to protect themselves, but also how to protect the public. And if the workforce doesn't recognize how to protect themselves, then they certainly won't protect the public. So we need to have some discussions on how to get back to something better. So thank you very much, and I'll appreciate your help.